Unit 9 is on the digestive system and nutrition. So there's a diagram that I'm going to show you here. And I think it's interesting because the digestive system starts all the way from the mouth and goes all the way down to the rectum or the anal canal. And it involves all the organs that are there in between as featured in this diagram as part of the digestive system breaking down the food that we take into our bodies and making it ready to become waste. So it's always important to know the changes in the GI system due to aging. And so as we age, digestion starts to take longer. The peristalsis, and I would know the word peristalsis, you'll see it on the test, slows, and this can lead to constipation. And peristalsis is that movement of food through the intestines, but go ahead and look that definition up. As a person ages, they may have more difficulty with chewing and swallowing, or a decrease in absorption of vitamins and minerals. They may also have a decrease in saliva and digestive fluids. There are three functions of the gastrointestinal system, and that's ingestion, digestion, and elimination. A few disorders of the GI system would include diverticulitis, which is inflammation of sacs that develop in the walls of the large intestine, or constipation, and that is when it's difficult or painful to eliminate the hard and dry stool, which is pretty common in the elderly because of that slowed peristalsis like what we just talked about. Fecal impaction is another issue, and that's where there's dry, hard stool that remains packed in the rectum and cannot be expelled. And then there's fecal incontinence, and that's the involuntary passage of stool or gas. This can also be called anal incontinence. Hemorrhoids is another issue, and this is enlarged veins that are in the rectum, and they can cause itching, burning, pain, or bleeding. If you're wiping somebody or helping somebody to wipe that has hemorrhoids, just be aware that sometimes regular toilet paper can get caught in there, and it can cause discomfort and pain. And there's a video about ostomy care in the video section. You'll want to go and watch that. Some other terminology you should be aware of. Ostomy is actually the surgical creation of an opening from the area inside the body to the outside. And colostomy is an opening from the colon to the abdominal wall, so that's the large intestine. It's lower down. Ileostomy is an opening between the ileum and the abdominal wall, so that's more the small intestine. The stoma is actually the opening itself. So sometimes people get ostomy and stoma and those words confused. It's just a picture of some different colostomy sites. If a person has a colostomy, the stool can be semi-solid or liquid. It's going to be farther down in the gastrointestinal tract, so it's going to be more formed like if you were to have a regular bowel movement, but it'll be somewhat soft. It could be liquid. It's going to be a darker color depending on where it is. An ileostomy, because we're dealing with the small intestines, this is going to be food that has that's very acidic. It's not been very formed yet to be like regular waste that we would have. So it can be very irritating to the skin, and the stool will be liquid. Kind of like a bright yellow color too. Diabetes is a disorder of the, it's a disorder that is an autoimmune disorder, and the body cannot produce enough or use insulin properly. Insulin is produced by the pancreas, and it's needed for glucose to move into the cells, from the blood into the cells to be used for energy. So if you think about insulin is the key to open up the cells to receive the sugar or the glucose. So when a person has diabetes and they take a bite of, let's say, an apple, and there's sugar in an apple, right? So you take a bite of an apple and you're eating this, but the body doesn't respond the way that it should, And so the insulin is not released. So the cells are not opened up to be able to receive that sugar or that glucose from that apple you were eating. So then that sugar then floats freely throughout the body, and it can cause damage to like the vessels or other parts of the body. Type 1 diabetes is usually what we think of like juvenile diabetes. It's early onset. Typically, it's a younger person. The pancreas will produce little or no insulin. This is usually autoimmune. This is something where it's not at fault of the person at all. They just they're healthy one day, and then the next day their body starts attacking the pancreas, and their pancreas doesn't work properly. Type 2 diabetes is more lifestyle. This is a later onset. It's something that can be that you can see coming. Somebody who's overweight, poor diet, not physically active, maybe has a history in their family, and the pancreas becomes very sluggish and doesn't produce the insulin that the body needs to work properly. So this is something that can be reversed with treatment. Type 1 diabetes, the treatment is insulin, diet, and exercise. And type 2 diabetes, it's diet, exercise, and they may take a pill or they may use insulin or both. The insulin for type 2 diabetes is typically more long-acting, where the type 1 diabetes is typically short-acting insulin. Hypoglycemia, this is low blood sugar. Hypo meaning low, glycemia referring to sugar. And so if a person has low blood sugar, they may be shaky or hungry. They might have some weakness or confusion. And this is something that if you see this in a patient, you want to report it to the nurse immediately. And if they have snacks ordered, if they're a diabetic patient, we should, as a nurse's aide, you should make sure that they're getting their snacks as ordered. Hyperglycemia, hyper meaning high, that's high blood sugar. Symptoms would be like weakness, thirst, frequent urination in large amounts. They may have a fruity odor to the breath. If you are seeing them act like they might have high blood sugar, then you would want to report that to the nurse. There are a lot of major complications that come from diabetes. Diabetes affects the whole entire body. So it can make them at a higher risk for heart disease, for stroke, blindness, kidney failure, and amputation because they have wounds that don't heal properly. We talked about the free-floating sugar that's not being received by the cells. When you have unmanaged blood sugars, there's lots of damage happening to the little vessels and the capillaries where that nutrient exchange is happening. And so if you think about the kidneys and the eyes and the feet and the heart and the brain, there's lots of little vessels within that area that are being damaged. Okay, so let's talk about nutrition. Nutrition is taking in and using of food by the body to maintain health. And the basic nutrients, you're going to want to make sure you review this because you'll see some questions about this. Water is the most essential nutrient for life. Fats are a source of energy. Carbohydrates are a source of energy. Think of some examples of what that includes. Proteins help with tissue growth and repair. Vitamins help with the body, and so does minerals. So we're going to talk about some special diets now. These can be ordered for certain diseases or illnesses or conditions. You have the liquid diet. So there's clear liquid. These are fluids that you can see through or that are liquid at room temperature. Or there's full liquid, and these are clear liquids with the addition of cream, soups, milk, and ice cream. That's a full liquid diet. And this can be ordered for a resident with nausea or vomiting, or if it's before or after a surgery, they may be on a liquid diet. Mechanical soft, this is for a person, think about a person who has dental problems, trouble chewing. So it's going to be foods that are soft and easy to chew. Ground meat, soft texture, mashed potatoes, you know, soft cooked vegetables. But like think about raw vegetables or fruit. Those would not be on a mechanical soft diet because that would have the crunch to it, which is not would not work for somebody who has dental problems, right? Pureed diet, this is food that is blended. And so if they have difficulty chewing or swallowing, their food may be pureed. And it's the same thing. You can take a cheeseburger and you can puree it, right? They put some liquid into it and it just is in a different form. So it's not liquid. Puree is not the same as liquid. It's just a different form of a solid food. Low sodium, this is where you have salt is restricted. So you have to be aware if they're on a low sodium diet before you bring them extra salt for their diet. They also may have certain like condiments that are restricted, like ketchup or soy sauce or something like that. And so a low sodium diet would be good for a person with heart disease, high blood pressure, kidney disease, because sodium makes you retain water, or it holds that water in, and then that can make it harder for the kidneys or the heart to process those things. A diabetic diet is very controlled. They're looking at calories, carbs, protein, and fat. There's right amount of food at certain times of the day, and the dietitian works very closely with them if they're on a diabetic diet. Thickened liquids can be used to help prevent choking or aspiration, and that's where food or fluid goes into the lungs. Anybody that has swallowing problems, it has to be ordered. There usually has to be a swallowing test, so it's not something you're like, I think we should give them some Thicket and throw some thickening agent into their drink. No, it has to be a specific order and a test that's done. This is just showing you that there's different consistencies, different amounts of the Thicket you can put in there to get a different type of consistency, whether it be nectar thick, honey thick, or spoon thick. And dysphagia is when there's difficulty swallowing. So there's dysphasia with an S, and that's difficulty speaking, but dysphagia is difficulty swallowing. So I just wanted to point out the difference in those things. When you're serving a meal tray for somebody, make sure that you wash your hands in between the trays or use a hand sanitizer. Make sure you are checking their diet card so they're getting the right food. Make sure you're giving it to the right resident. And don't do what a resident can do for themselves. So if they can open up or they can cut their food or whatever, let them do it. But if they need help, obviously be there. We don't call these things bibs. They're called clothing protectors. We want to give dignity and choice. And the resident has to ask for it, or they can choose whether they want a clothing protector or not. If you're feeding a resident, make sure, once again, that you're washing your hands, that you're maintaining that face-to-face contact, and alternate food and fluids according to that resident's preference. Small bites. We don't want overloaded spoons. Make sure they get plenty of liquids throughout their meal, and make sure that they empty their mouth before the next bite. You don't want to just be shoveling it in. Some people, you're there for a long time feeding them, and that's just the way that it is. But you want to give them that opportunity to eat. Make sure you make it a social event too, and you're talking to your resident during the meal. If you're helping a resident who's blind, you would want to use the face of a clock to explain what's on the tray. So the baked potatoes at 12 o'clock, the meat is at 6 o'clock, the peas and carrots are at 3 o'clock. If you use like a clock figure or face of a clock, that will definitely help. Make sure you're observing and reporting if there's any swallowing problems. If they're coughing a lot while they're eating, that could be indicating a swallowing problem. You want to report that to the nurse. Also, documenting food and fluid intake is an important part. Resident rights, they do have a right to refuse food and drink. They have a right to ask for different kinds of foods. And make sure you're letting the nurse know if this happens. Nourishments might be ordered and for a specific time or specific amount, like we talked about with a diabetic. We need to make sure that if they have a nourishment ordered, that we are offering that to them or delivering it that to them when they're supposed to have it. And if they don't eat it, we need to make sure that the nurse is aware, because if they are doing it for diabetes purposes, it might make their blood sugar drop. Then